So, Namaskar everyone. My name is Dr. Manish Yadav and I'm from Mumbai, India. Today we will go on a journey to understand a very important remedy. The remedy's name is Medorrhinum. Now, Medorrhinum is a remedy which is being extensively used in our practice, in our clinical practice. In fact, I know some physicians who have some great results with Medorrhinum in their day-to-day OPD. In fact, I have been also using Medorrhinum in many of the instances. I have got wonderful results, especially in some cases where I was stuck and I was not moving ahead. So Medorrhinum as a remedy, as we know, it is a nosode basically, and it is used as an anti-miasmatic remedy many a times. So when we prescribe as a remedy as an anti-miasmatic remedy or a nosodal remedy, generally what happens is that many times the prescription is very vague, and many times I have seen the prescription comes to be very empirical. So what about this? How can we get away from this empirical prescription or a casual prescribing of nosodes? This series is basically about that. I'm going to come up with more nosodes, the regularly used nosodes, and with the indications. So let us go directly on Medorrhinum subject. We'll go directly to the subject and try and understand the remedies. Now, the question is, why should we understand nosode as a remedy? It is very crucial because we know there are certain anti-miasmatic remedies. There are certain categories of it. Definitely it's there. But even when you prescribe as an anti-miasmatic remedy, in my experience, when you prescribe on individualizing and even anti-miasmatic remedy, you have to individualize. When you individualize and give anti-miasmatic remedies, your chances of recovery, health, and results increases. So versus empirical prescription versus properly clinically diagnosing and prescribing on individualizing symptoms. So it is very crucial for us to know the anti-miasmatic remedies, but also it is very crucial that we should know the nosodes or even the SAR codes if they are approved. But here we'll talk majorly about nosodes. It is very important and crucial that we should know nosodes as an individualizing drug remedy. Means if I have to prescribe as a constitutional remedy, I should know the indications of the nosodal remedies. Why I'm emphasizing on this part is that because I have been giving Medorrhinum many a times as an intercurrent remedy, many a times. And I'll tell you, whenever I have been giving Medorrhinum on indications, means a small indications, the indicated drug, the result has been very good. So for that, it is very crucial that we should know Medorrhinum in depth. So this journey is basically, I'm going to take you through a journey of learning and understanding Medorrhinum from a deeper perspective. Of course, the learning Mater Medica is a big subject. It is just a start. So I'm just going to share you whatever information, whatever knowledge, whatever understanding about Medorrhinum I have got with you all. So let us go on the journey of embarking. The key point is about Medorrhinum. So let me go to my PPT. Yes. So definitely we know this Medorrhinum is a nosode. So when you want to start and understand Medorrhinum, there are two terms that you have to understand. One is hereditary psychosis and another is constitutional psychosis. Now, what is the meaning of that? Hereditary psychosis means when the psychotic state is being transferred, is being carried on from generations, from ancestors, from parents, it gets transferred to the next generation, the children's. This is called hereditary psychosis. So it is very crucial that we should know the symptoms, we should know the indications of this nosode, so that when you are inquiring about the family history, you are able to cite and say, okay, we have a Medorrhinum case with us. So that is called the soil of the patient, on which the breeding ground, the symptoms come. What is constitutional psychosis? Constitutional psychosis basically in the process means it is not being hereditary, but in the process it is being acquired, and it is not being treated properly but suppressed in initial years. You will find many a times that patient was absolutely all right, But when you go back and you find out this, he was absolutely all right for maybe 10, 20 years or something, or 10 years, 15 years. Then the first illness that happened, it was suppressed. And from there, the entire range of diseases came forward. So it is very crucial to understand the course of illness. Many a times, what we do is that in our practice, we are always looking for finding the constitutional remedy. And for us, the understanding of constitutional remedy is what? The understanding is we have to understand the mind, the general symptoms, which is important. But it is very crucial to understand and pathophysiological connections also. From where the disease starts. If the source of the illness, the etiology of the illness is hereditary and it is psychotic in nature, then Medorrhinum can be one of the remedy. Or if it is being suppressed, in a way. For example, I'll share you one case. I read just one case in the article, very nice case. So this was a child, and this child was having some difficulty, asthma, and many more complaints he was having. So he was being treated by some physicians. Partial recovery was happening, but not major recovery was happening. And then he was referred to another clinician. Now, this doctor, senior doctor, he saw the patient and he said, okay, the patient is having asthma, patient is having this, that, other trouble. And he knew that a lot of remedies have been prescribed. So he looked at the patient, he got some idea about the constitution, and then he just asked the parents, especially, he went back and took the history of mother and father. And on asking father specifically, he understood that father had suffered from gonorrhea. Now you'll ask, okay, this in today's generation, we don't find gonorrhea. Definitely, we don't find gonorrhea because it's been suppressed. But there is a way. Nothing is suppressed, my dear friend. Every disease tries to show its parts. Like tuberculosis, we say it is being annihilated, but do you really feel it is there? It is not there. It is there in the society. So when you talk about psychosis, the most important question that you should ask the parents or the patients is, any time in your life you got white discharge from your urethra, from penis, like while urinating, or some white discharge is coming out of one, or some urinary tract infections you had, something to do with urethral infections. And then father confirmed, yes, I was suffering from this, but I took medicine and I was better. After that, the son was born. So from there, he traced a psychotic background, gave Medorrhinum, perfectly better, no complaints. That was a wonderful case which I had read. And I use this tip many a times in my patients. I'll tell you, I use this tip many a times in my female patients also. I've seen many females who come and say, we were absolutely fine, doctor, before marriage. After marriage, my trouble started increasing. You must have seen so many females who were lean, thin, proper build. After marriage, not about pregnancy, like delivery, forget that. Even before that, you'll see damages happening in their body, especially the urogenital areas. Some will get cysts, some menses difficulty, some, neurological complaints. So many things start happening. How come that happens? And the answer to this question is given in Allen's miasm. When you read Allen's miasm, he says that when married women, you have to trace the history of husband. If husband suffered from UTI, husband suffered from white discharges from urethra any time in his life. If not, you can send the wife out and just ask the person very politely and very subtly. So from there, the psychosis can get transferred to the wife itself. And from wife, it can get transferred to the children's. This is called hereditary psychosis. And constitution, you understood, like suppose that husband is there, that person is there, or the female is there, and they had these urinary tract infections, or white discharges and other things which were there, which got suppressed, and after that the illnesses started. So that is constitutional psychosis. So keep this thing in mind. This is number one clinical tip for prescribing Medorrhinum: hereditary psychosis and constitutional psychosis. So let's talk a little bit more about hereditary psychosis. So we'll focus on hereditary psychosis. What are the symptoms? Of course, you have to go in family history and ask about the diseases they have suffered, which is okay. But once patient is a carrier of psychosis from hereditary, like suppose a child is there in his young age, there should be some symptoms, right? We are always guided by signs and symptoms. So what are signs and symptoms when a child comes to you and looking at the child and the pathology or his symptoms, how can you understand that this is Medorrhinum? So let's start understanding this. So when the soil is hereditary in psychotic, now this is the prime symptom of Medorrhinum, which I feel. Lacks nutrition though eating well. Now we have got many remedies like, we have got iodine, we have got so many other remedies where patient is eating, but is not getting well. But Medorrhinum is also one of the remedy where the entire problem revolves around nutrition. It is not about that they are not getting good food. It is about they are getting good food but lacking nutrition. So keep this point in your mind. So despite sufficient food intake, psychosomatic growth or development of the patient is not adequate. Of course, here I have given a photo of an elder lady, but now I'm talking about children's. So you will find how the symptoms will be there. Like suppose lack of nutrition is there. Okay, if lack of nutrition is there, like when I talked about iodine. Iodome's sphere of action is completely different. There will be some other general symptoms and pathologies. When you talk about Medorrhinum, what does get affected? Psychosomatic growth and development of patient. The remedy that comes very close is Baryta carbonicum. In fact, when you read Boric, there are many places in Mater Medica also, even in Boric, it is written dwarfishism. Dwarfish. Now, dwarfish is the word which is written, which is definitely used for Baryta carbonicum. So it is very close to Baryta carb. Many a times you think of Baryta carb, but it is Medorrhinum. What is the difference between Baryta carb and Medorrhinum? In Baryta carb, mental faculty is there. It is feeble. The mental faculty is feeble. There is problem. Okay. Imbecility is there. Embarrassment is there. Shyness is there. Timidity is there. Those are the components. But what about Medorrhinum? Medorrhinum has developmental arrest, has psychosomatic problem, but the behind this is nutrition. They're not getting nutrition properly. The body is weak. How do we understand that? The most important investigation that you should do is blood test, and you will find anemia. Anemia is running through the patient. So in background, maybe in Baryta carb, you will not get anemia. In Baryta carb, patient is eating well and he is good build and body is good. But in Medorrhinum, you will see pallor. You will see signs of anemia. Anemia is very important part of not just Medorrhinum, but entire psychosis. When you read Allen's miasm, he talks about specifically about chlorosis and anemia. He says anemia, even la grippe is coryza. Recurrent coryza and anemia is a part of psychosis today. In fact, today, very nicely he writes down 80%, Allen's miasm, he writes down 80% of the cases that we see are psychotic in nature. And as we go deeper into it, you will understand, you will definitely, once we finish this lecture, you will understand, yes, what he says is right. You will see the features of psychosis around you, even in their mental faculty, even the physical faculty. You'll see a lot of people are getting into psychosis. They're becoming psychotic slowly and steadily. We'll come to that. So investigation and looks anemia. Anemia is his inborn feature. What he says, anemia is inborn feature. The mother will say, oh doctor, since childhood, his blood is always less. Now we see that in India, female section, we see anemia a lot because of nutritional problem. That's a different story. But here, irrespective of the gender, the parents will say, we give so much iron supplements we have given. We take care of proper iron, diet. He's being anemic. And when you see generally, you check for the signs of anemia, you will find it. Definitely you'll find it. How is the look? Bloodless, pale, ashy face. And of course, the signs of anemia is quite evident. So from where we started, we are talking about hereditary psychosis symptoms. We started with the basic background, whatever symptoms you see outside, okay, developmental arrest, psychosomatic problem, XYZ. What is behind that? Behind that is nutritional lacking. Eating well, but nutrition is lacking. But where will I find this? Where is the action? What is the sphere of action? Is anemia. So in the body, there is anemia. And you also know that when somebody is anemic, there are already a lot of physiological symptoms that come up. Pathophysiological symptoms come up. But the problem is anemia. So anemia, which has not been controlled by diet, which has not been controlled by supplements, definitely it is an intrinsic problem. So you have to look into that. That is the real understanding of the soil when we talk about hereditary soil. A child carries a hereditary soil, means the background is anemic in nature. Now, when there is anemia, what else can happen? Now, nutritionally is lacking. Can't remember. Other faculty which is affected from psychosomatic and physiological thing is memory. There is memory weakness. So what happens here is that now when a person is anemic, or even thinking, like suppose I'm talking to you, I need so much energy I need in my mind. If my blood circulation is not proper, memory weakness will happen. So child will complain of memory weakness, especially can't remember what he has read or he has listened to. Very much forgetful. These are some very important features of children. So now when I'm talking to you, I hope I'm able to create a picture of a child. I'm specifically talking about children. In children, how should we able to spot Medorrhinum? That's the purpose of this talk right now, initial talk. So try to get a picture of this patient. What else? Let's talk about the mental symptoms once we have got into that. Very important is two words are very important here. One is envy. So one side you see mental weakness means patient psychosomatic development is not there. Maybe his milestones are a little delayed. There is a lot of weakness, memory. He's not able to concentrate. He's not able to read. He's not able to remember. He's forgetful. But along with that, the other component which differentiates, because there are so many remedies which might have these symptoms. But what are other components which will put your Medorrhinum in top list? The other characteristic quality is envy. Now, what is the meaning of envy? Let's understand this. The meaning of envy is basically the feeling that you have when somebody else has something that you want. Envious. Oh, my brother is having nice pen. Oh, he has a good bag. Oh, he gets more love. He gets more care. The feeling of envy starts developing in the children. You can think about jealousy. Now, we say sibling jealousy, but it is not just jealousy. It is envy means when others are happy with something, I am not happy with that. So the children will always feel sense of neglect, forsaken, always being, somebody else is being pampered, somebody else is being loved more. That feeling continuously harbors in them. But along with envy, there is one very important quality is malice. What is the definition of malice? Wish to hurt others. Now, envy, if it is just envy just feels envious. Okay. Maybe jealous with others and comparison is there. That is envy. What is malice? They are cruel also. There is one word called cruelty written in Medorrhinum. So they can be very cruel. They feel good when people are hurt. Like suppose if they have some jealousy with their brother or sister, they will internally feel very good if others are hurt. So cruelty. So along with, now understand the mental symptoms. Along with memory weakness, okay, all those things, envy and malice, jealousy and malice, hurt others happy when they see. He always has this feeling, irrespective of whatever you do, that others are getting more love and affection. Feeling of being ignored and neglected is very important in that patient. Dwells on this notion. Now, this idea gets fixed. Now, fixed ideas. Now, fixed ideas we know from Thuja. Fixed ideas is an important component symptom of psychosis. Especially we talk about Thuja, but it is a symptom of psychosis. So here also there is fixed idea. Now, what fixed idea he has? The fixed idea that others are being loved more, affection, care is given to others, and I'm being ignored. How much ever counseling is done, how much ever good things are done to them, but they will always feel this feeling is ingrained in them. This is called fixed idea because they will keep dwelling on this notion. You cannot get it out from their mind until and unless you give a dose of Medorrhinum. Hence develops from very childhood days. So what happens is that to try to understand the chronology. This feeling is harboring in them since childhood. So what happens? The symptom comes in there. Antagonistic feeling towards members of the family. Now, this is very common, right? If suppose I am there as a child and I have this feeling, it's fixed in my mind that others are always being loved, others are always being cared, I'm always being ignored. This feeling, and I'm 24/7 dwelling on it. What will happen? I will develop a kind of hatred or kind of repulsion towards my family members. And the feeling is antagonistic feeling towards the members of the family. Now, what is the meaning of antagonism? Antagonistic feeling refers to strong sense of opposition, dislike, hostility towards someone or something, often characterized by unfriendliness and desire to oppose. So antagonistic means oppose, contrary. So parents will tell you, whatever we say to this child, he will always do opposite. If we say drink milk, he will not drink. If we say whatever good things the parents will try to help them explain, he will always do the opposite because they want to oppose. You see in our parliaments, I'm just giving an example, opposition. The other party, the ruling party is there and opposite party is called opposition. You know why it is called opposition? Because their role is only to oppose. Even if ideally it should not happen, but yes, even if any government is doing good things also, they will still stand up and oppose. And if you ask them, but sir, this is good enough for country, why are you opposing? You know what they say? Arey, we have to oppose now. We are from opposing party. Opposition. So that's just a joke, but that is what you find in children's Medorrhinum children. So antagonism. So now let's summarize again the mental symptoms. One part you'll find the weakness, psychosomatic development is hampered, due to anemia, memory, all the problems of memory. But along with that, they will have envy, malice, and an antagonistic feeling towards the family and cruelty also. What are the mental symptoms? He may lack general intelligence. Now, that is quite evident, right? If somebody is having memory weakness, forgetfulness, they can't comprehend, they can't remember, how can intelligence develop? That is quite common. So they will lack general intelligence, but naughtiness and mischievousness has in abundance. You might have seen some children in school, now they're not that intelligent. If you ask them to read something, learn something, they will not remember, but they will be very naughty and very mischievous. Now, here the another remedy that comes in mind, especially when we are treating children, is tuberculinum. We always think of tuberculinum and tarantula when we see naughty, mischievous, restless children. So we should be careful in distinguishing all the three of them. This one point will differentiate from the tubercular child, tuberculinum and tarantula, both tubercular child and Medorrhinum. He has penchant of activities which irk parents and guidance. This is the word written in the book, penchant. Now, which irks patient? Irk means irritates, simple. So they have certain kind of activities they do which irritates the guardians. What kind of activities they do? Tubercular children are restless. Their main goal is to keep them busy, change desire for. They will always keep running here and there and always change, restless. But what is penchant of activity in Medorrhinum? So let's understand the dictionary meaning. The penchant activity refers to activity that someone has strong liking for or strong tendency to engage in. Means one thing they like, they will go deep into it and just do that and that and that. It indicates a habitual attraction or a particular taste towards something, whether it is hobby, behaving, subject of interest. So this is the difference between a Medorrhinum child and a tubercular children. Tubercular children's, their idea is to change. Medorrhinum is not like that. Medorrhinum, they will get stuck to one thing. Like one strong liking they will develop. It could be in behavior, eating, subject, anything. Like suppose drawing, for example. You might have seen that, parents say that, I don't know what doctor she just keeps drawing and drawing and drawing and drawing. Just give her, she will keep drawing and drawing and drawing. Now here we think, oh wow, the child is so creative. No, look at the drawing. When you go and look at the drawing, you see, oh my God, it's not that great. But she will keep drawing, drawing. Why? This is called punching of activity. One strong liking and then get attached to it. It could be for taste. It could be for food also. Like, there are some children who will just eat one kind of food always, always, always. This is punching of activity. Behavior, some kind of behavior they have got that will get stuck. They will get stuck to it. Why? Because they develop strong liking towards it. Now, we are talking about children's, but take it to an adult, the symptom will remain the same. You'll find the same thing in teenage also, even adults also. That pungent of activity, once they develop a kind of, addiction, not addiction is the right word, but strong liking towards it, it becomes a habitual thing. And when it becomes a habitual thing, that irritates the guardians and the parents because they know this is not right. If you want to watch a movie, you watch it for 2 hours, 3 hours, and then wind it up. But every time you're free, you want to just go and watch the movie and or just order pizza every day, have something like that. So be careful. So this is how we can differentiate between tubercular children and Medorrhinum children. So now we are still talking about hereditary psychosis and their symptoms in the coming generation. So we talked about the center point keynote was lack of nutrition. So definitely there has to be some problem with the digestion. They have got weak digestion. Medorrhinums have weak digestion. The problem is that crave food what he cannot digest. This is very interesting. The digestion is very weak. They will always be having stomach ache, gastric problem, diarrhea, constipation, vomiting, but they will always crave the things which they cannot digest, like pica, pencil, okay, chalk, or today's fast food. Look at this. All fried items, the fries, the burgers, the pizza. These are not good foods, right? You can have it once a while, but they will love this. And these things, whenever they eat, they will have digestion problem, but they will still crave for it, especially fried items. So all these undigestible items which they cannot digest, they will have strong craving. Or in children's, chalk, pencils, and as they go adult, definitely you'll find a lot of craving towards junk food. Now you understand why Alan says that 80% of the public today is psychosis. Maybe the lifestyle that we are into, that also causes this kind of state to come in. Maybe. So let's go ahead. So when we're talking about food, we should talk about thirst also. This is a very important symptom of Medorrhinum, excessive thirst. You can see this photograph is very good. He's drinking the entire gallon, right? It is written in Alan's keynote, excessive thirst, even dreams of drinking. Means we say in Hindi we say something we want to connotate to a very high level. We always say, even in dreams he sees that. Means it is so excess, unquenchable. They will keep drinking. Even in dreams they will see water. Okay. So great thirst, excessive thirst is a very important thing. When dreams she is drinking. Another general symptom, sleep on abdomen. Now this symptom everybody knows. They feel better by lying on abdomen. This is the position they have. In fact, there are symptoms like cough better by putting face under the pillow, on the pillow. But most of the complaints or his general amelioration is lying on abdomen. Now, this phenomena is seen in children, not in children, especially in infants. That is common, but you see this phenomena in adults, and this is very important. Now, what about other general features? Sweating, profuse sweat wets the pillow like calcura fos, sanicula, silica, severe thing. But along with that, they will have offensiveness, offensive stool and offensive urine. How do you know that? The mother will come and tell you, maybe you are giving Sanicula or Calciraphos to the child, but mother will come and tell you, doctor, now things are better, but you know what? Her stool is so offensive. We can't stand. Urine is very offensive. This offensiveness is a very important symptom of Medorrhinum. Calciraphos and Sanicula, maybe Sanicula, but Calciraphos and other remedies, it is not that much there. So discharge is offensive. Psychotic remedy. So when you talk about discharges like coryza or expectoration, generally not whitish, yellowish or greenish. Now comes a very important point. Now this is very interesting. A lot of people ask me, many questions have come that, sir, what about thermals? Can we just look at thermals and give the remedy? So this is quite dicey. Okay, let's understand what about Medorrhinum. It is said that Medorrhinum is hot patient, and I've seen many people prescribing on thermals, which is absolutely right. But my dear friends, now I'm going to give you something for caution. Look at it, what he says. So definitely he's a hot patient, definitely. But extremities are cold, but he is hot patient. Now this is interesting. The body is very cold. So when you touch his extremities, they are cold. But if you ask the patient, they are very hot. They can't tolerate heat. This is contradictory feature of Medorrhinum. He wants cold internally and externally. So this is strange, right? A patient comes and says, my extremities are cold, doctor. You will think he will want covering. He will want, cold things, warm things. But no, outside he is cold, feeling cold. But like sickle cord, sickle cord. Outside is cold, but he wants inside it is very hot. So always crave for cold. This is the way you can differentiate Medorrhinum. Prefers craving. Of course, we talked about junk food and other things. But generally, when we talk about dishes, sweet and salt. I remember Shankaran sir, when we were learning, he used to always say that Pani Puri is the best example for, Medorrhinum patients. Okay. But of course, not everybody likes Pani Puri. But when it is excess, generally what he was trying to say is sweet and salt. The mixture of this sweet and salt, that is what they like. And cold dishes. So I told you, he's hot patient. He wants everything cold. Internally cold and externally cold. Internally cold means cold drinks, cold dishes, cold food. We have got remedies like chelidonium, lycopodium, many others where the crave spongia gets better with warm water and food. But this patient, Medorrhinum, likes cold dishes. They will want cold things coming up. Now, this is very interesting. This is what I was trying to say when I was talking about hot patient. They are hot, but it is so strange that they are susceptible to cold. Now, how can this happen? This is very contradictory, right? Don't you think so? Patient is hot. Okay, patient is hot. He craves cold. Understood. Extremities are cold but internally hot. Understood. Patient is hot, but they are susceptible to cold. This is the unique feature of Medorrhinum. So they are hot, but they are extremely sensitive to cold. Averse to covering is okay, we understand. Okay. So please, my dear friends, when you think about thermals, they are definitely hot. But don't get misled if patient says, oh, if I get exposed to cold, I get coughing, my asthma increases. Then you'll think, no, this is not Medorrhinum. No, it is Medorrhinum only because they are hot, but sensitive and susceptible to cold. Though because their extremities are cold, but they will crave warmth more and more. So now here we stop the hereditary psychosis. Now we come to the symptoms which are amidst hereditary and constitutional psychosis. Generally, when we don't see, in the background, family history, we don't have suppressed psychosis, but as a constitutional, means it is a mixture. In day-to-day practice, what are the symptoms that we will see? We'll try to understand that. Features. So I will just talk about the features in one pointers. Memory weakness. As we understood, we have already talked about, I'm just repeating. So what are the features in day-to-day practice? Memory weakness. weeps while narrating his pains and suffering. Now we have got symptom, we have got rubrics. Weeping while telling symptoms. You know, so weeping while narrating his pains and suffering. We have got weeping while telling symptoms. We have got Kalika. We have got so many other remedies like internally extreme fear of death, disease, future, but externally maintains his aura of brightness. Now this is interesting. When you read this sentence, this exactly talks about psychotic feature. This is psychotic disposition. What is psychosis? Psychosis is I have got an internal weakness, but I cannot show it to the world. So when they go out in the world, they are very bright and bold and robust. They will try to show. But inside, there is lot of fear lurking about death, about disease, about future. So when you talk to the patient and slowly go deeper, then all these features will reveal. So by looking, by behavior, by his talks, he looks quite bright and bold and this and that. That is just a cover up of his weakness. This cover up of the weakness is psychosis. Now, I told you, now, when you listen to this talk, you will try to spot psychosis even in the individual surrounding you. Look at today's generation. Look at today's people. How are they? Everybody has got some weakness inside, but we are being programmed or not programmed. I don't know, but that's the way we have been living. We try to we mask our feelings. We cover up our weaknesses. We try to become very strong in front of others, but internally we are not like that. So psychosis is hiding everything. Hiding is important component. Cover up is important component of psychosis in general, and even for Medorrhinum. Intolerance to others' well-being, efforts to outfit others by any means. So intolerance to others' well-being, envy. We already talked about. Efforts to outfit others by any means. What does it mean? This is called malice. Means I have to win anyhow and get the person behind. Means I will feel happy when they are hurt. So envy and malice, important component. So envy, malice, and cruelty. What is cruelty? You feel good, when others get hurt. Now, when we say caustica, phosphorus, they're very sympathetic. These people are not sympathetic. They will feel happy in a way when others get hurt. That is cruelty. And last, another important component is why this comes up. Now, we have to understand this in today's world, why it is so important. The very important mental symptom is that self-conscious and self-centered. So when you look at Medorrhinum patient, generally they are very self-conscious, means always thinking about them, selfish that we can call, and self-centered. This is present day's life. Nuclear family culture is broken now. Now, what is happening? Generally, when you see in your family, in your society, what is happening? Since decade or so, nuclear family concept is coming up. So joint family concept is gone. Now, every family, once they get married, they're always thinking about themselves. So it is self-centered, self-consciousness. Now, this thought process, this behavior is rampant in the society. If you can't believe this, just go and try and observe just go and talk to people what problems they are facing in their family. And you'll understand that, when they were children, they were sharing, loving, caring, everything. But now as their families grew, now as they got married, having children, they started fighting for the things, the property, the money, the everything. Everybody started thinking about their well-being, not concerned about others. So maybe our society is becoming like that. That is why 80% psychosis. That is why. Okay, I'm not saying you find this, you give Medorrhinum and they will be cured. No. This is for diseased patient. But these are the features which will help you to corner or to, come closer to the Medorrhinum state. Now we come to the diseases. How can we understand through diseases? Okay. Just give me 2 minutes. Let me get back to it. So we talked about hereditary psychosis. We talked about in general features. It's very simple, right? yeah, this is how these features we can take help and diagnose Medorrhinum. What about diseases? Of course, now when I come to this point, we are not saying that looking at disease you prescribe the remedy. No, but yes, remedies have got their pathophysiological connection. Through diseases also you can understand the state. You can understand the lurking miasm in that. So what are the diseases? What are the spectrum of diseases or pathophysiological spectrum of this drug? Anemia. Of course, we learned about anemia is the important component. Rheumatic problems, joint problems in the past, in families, or even in the patients. Inflammation of mucous membrane, throat, mouth, anus, inflammations, always suffering from some or the other inflammations. Nerve diseases, especially, you will find that when you read Medorrhinum, you'll find objective trembling. You find a lot of trembling happening in the patient. So trembling, nervous system. Now, this is very understood, like stricture urethra is strictures, especially now understand this. Urogenital area is psychosis. Remember this. Just keep this in your mind. Urogenital area means anything to do with urogenital area means urinary organs and genitalia. Whether male or female, it is psychosis, predominantly psychosis. So stricture of urethra is an important pathophysiological area for Medorrhinum. Enlarged prostate, Medo. Okay. Arthritis, we talked about. Heart diseases, rheumatic diseases and rheumatic heart diseases, heart component. Hypertension is also psychosis in a way. Diabetes in today's world, because diabetes is today's disease. Whatever is today's disease now can be psychotic diseases. Please understand that. Even some forms of cancers also. Female pelvic disorders. Now, I'm not going to open here, but I will tell you that go and read Medorrhinum third paragraph in Allen's keynote. Third or fourth paragraph in Allen's keynote, where he has written a lot of things about ovaritis, salpingitis, uterine fibroid, all the inflammations, pelvic PID, all the inflammations of female genitalia can be termed under Medorrhinum. Allen's keynote writes that as a disease. So remember it. Sterility. Now, infertility is a very important factor here, okay, in today's world. So when you find sterility on psychotic basis, means it is not a specific remedy for sterility, but you find a female, there's sterility, and I told you all the things about psychotic background. If you can trace those psychoses, maybe in the husband or in the wife, then you can think of giving this remedy. Edema, swelling, ascites, etc., etc., etc. And last but not the least, very important is fallopian tube affections. Basic characteristic of psychosis. You will find in today's world so many female patients affected with fallopian tube affections. So this comes in range of psychosis. It is a basic characteristic of psychosis. So what is important? Is something very important. Being crippled by arthritis or other deformities, etc., of joints, these patients ultimately breathe their last after being paralyzed from cerebral stroke or heart disease. You will understand this after you're 10, 20 years into the practice. When I had read this thing for the first time, suddenly I remembered one patient. This patient I had seen this lady when she was paralyzed. Cerebral stroke was there. I got a chance to treat that lady, but it was in my initial practice. I must have given some remedies, but that time my knowledge, my understanding was not that great. I was just learning. And especially about miasm and anti-miasmatic remedies were not ingrained in my mind. In fact, I would not think about it. I would just try to find out the indication and constitutional drug. If I ask myself sincerely, I couldn't help that lady much. Ultimately, of course, they were taking some other treatments also. Ultimately, we lost the lady. Cerebral stroke already had occurred. and she got sudden heart attack and we lost her. So this is the way patients go by. Psychosis, though it is said it is not dangerous, but it remains slowly, it engulfs the entire economy. So if you find such past history, oh sorry, not past history, family history, like, patients come and say that their parents or their, people were crippled with this, and after that, they have suffered from all these things. So this also gives you an indication that you are handling a psychotic individual. Okay, so get to the note. So in part two, I hope the part one is all over. Uh, let's go to the part two. I will finish in one video only. Before I was thinking to make two videos, but if you get bored or if your interest is lacking here, I can understand. You can take a pause. You can come back and do the part two. But I will continue and finish this lecture in one go. What about part two? The characteristic symptoms. Now we'll talk about characteristic symptoms for selection of Medorrhinum. Means if I have to give Medorrhinum as a constitutional drug or indicated drug, what are the characteristic symptoms? Till now we understood the miasmatic symptoms, the hereditary, or the other indications between constitutional and hereditary states. So let's look for the characteristic symptoms for selection. So starting, maltreated or suppressed gonorrhea in past. So history of, for that you have to trace the family history and especially the past history you have to trace. Acquired or hereditary psychosis, we already talked about. Psychotic fig wart or genital wart or a tumor. This is the sphere of action of psychosis as we know in children. Anemia and pallor, now we know nutritional deficiency. Mind, envy, malice, self-conscious and forgetful. When you find all four components together, you first give Medorrhinum, then only think of something else. Envy, malice, and self-conscious and forgetfulness. As a pace, very hasty. Medo is a very hasty remedy and fearful also. We talked about, right? Outside we will look strong, but there is a lot of fear lurking inside. Fear of disease, fear of death, fear of future, but very hasty and hurried like Argenta, sulfuric acid, lycopodium, very hurried. Desire to lie on abdomen and relief thereof. Excessive thirst. Desire for sweet, salt and cold food. Do remember this. Ravenous hunger immediately after eating. You know this, so many remedies are there. But Medorrhinum is one of them. Now you know why this happens, why hunger comes. Because the food that they're eating, body does not absorb. Body does not absorb. So that's why ravenous hunger immediately after eating. Okay. Other features, skin cold yet craves for cold and throws off covering. You will see a child, the mother will come and say, doctor, her body is cold to touch, but she will never take covering. This is Medo. This could be Medo. Burning sensation of palms and soles. Now this is very, very nice. I have prescribed many times Medo in this. Burning sensation in palms and soles relieved by cold. Wants them to be covered. Now there's something interesting in Medorrhinum. In Allen's keynote, let me just open it. Okay, just give me 2 minutes. I had read something about Medorrhinum and have used this. Zincum plus sulfur is Medo. Yeah, zinc plus sulfur is Medo. Just give me 2 minutes. It is written in Allen's keynote. You can go and read. Burning feet of sulfur, restless fidgety legs, and feet of zincum. They both found at the same time in Medorrhinum. So when you see a patient who is very restless, always fidgety, and they are burning in palms and soles, you give Medorrhinum, not sulfur, not zinc. So sulfur and zinc, when you find together, Medo could be the remedy or the anti-miasmatic one. Restless at night from rheumatic pain, restlessness, fidgety legs. Now, this is the interesting modality. I will take few seconds, wait on this. What is written here? Of course, we know there is a rheumatic complaint, arthritis, and this is one of the problem for patient. The grand modality of the most important modality of Medorrhinum is daytime to night, sunrise to sunset, sunset to sunrise, syphilina, sunrise to sunset, Medorrhinum. As the morning comes, as the sun goes up, complaint increase. As the sun comes down, complaint decrease. That is a grand symptom, grand modality of Medorrhinum. I have prescribed this remedy on this basis many times. But what about rheumatic problem? Is said restlessness at night. Now this is very interesting. This is syphilitic, right? Night aggravation is syphilitic generally. I'm not saying Medorrhinum is syphilitic, but Medo as a drug, also you can see some syphilitic symptoms there, but it is not syphilis. It is Medo symptom. So don't get confused. Okay. Oh, night aggravation is there. My patient says joint problem. Always in the night it aggravates. We always think of syphilis, mercury or syphilitic remedy. No, it could be Medo also, because specifically the rheumatic complaints start in the night. Tendency for tumor formation. Rouse from sleep with suffering. So night is a problem for Medo also, like syphilis. So you'll find there's one very important symptom. Patient is lying down. Oh, suddenly they will wake and they are suffering in the night. We think it is syphilitic. No, there could be Medorrhinum. Just look into the background. So try to remember the symptom, very important. It comes very close to syphilitic remedies, but it is not syphilis, it is Medo. Roused from sleep from suffering. So they suffer, and they get up and they have all the troubles. Okay. Another thing is mentally and anticipation. When you read Alice Keynote, other features, anticipation is one of the like envy and other things that we read, memory weakness, envy, and all those things. Anticipation. Anticipate, it is written in Mathematica, anticipates matter before they occur, and generally it is correct. They anticipate so much. Law of attraction works for them, I think, in a wrong way. But it is too much anticipation. There's a rubric, anxiety when time set in, Argentum and Medorrhinum. If there's some time set in, there's so much anticipation is there. Like you will think of Gelsemium, you'll think of Argentum, but it is Medorrhinum. So who will anticipate? Who has got fear inside? So I told you, psychosis. Outside they're very strong, but inside a lot of fear lurking inside. That creates a lot of anticipation. So if they have an appointment, if they have to meet somebody, have to do something, they will anticipate a lot. Nocturnal enuresis, especially with history of psychosis. Again, I've come to nocturnal. Now I'm just trying to emphasize this point because many times we do a lot of mistakes with this. Night aggravation, we always think of syphilis, but nocturnal enuresis, especially in children. So early bedwetting patient comes to you. You're giving remedies, nothing is happening. And mother will say, if he sleeps in afternoon, nothing happens, doctor. If he sleeps in the night only the problem comes. Go back and look for the past and the family history and other features. Few of them you'll find out. If psychosis history is there, give Medorrhinum, patient will get better. Okay. Breast and nipples sore, not just sore, cold as ice and sensitive to touch. You saw some places where it is written it is a remedy for cancer. See, a breast patient comes to you. You go in the past and ask, when the trouble started, before cancer started, tumor started, what were your breast symptoms? They will tell you, my nipples became sore, doctor. It was painful. And then it used to feel very cold in the nipples and very sensitive to touch. Then you look at other features, you'll see a lot of psychotic things in the background. Medo maybe will help this patient. Even with cancer breast, it can help. Tendency to catch cold easily. Yes, remember this, okay? All thermal people. Hot patient. Extremities cold. Tendency to catch cold easily. But they will crave warm. Trembling, subjective all over. Subjective. Earlier, I think I said objective. No, subjective. Patient will tell you, see, doctor, my hands tremble. Maybe you might not be able to see so much, but they feel hands trembling. Internal trembling is there. Now, one more feature of syphilis, insatiable craving for liquor. Now, this insatiable craving for liquor, which other remedy you know? Syphilinum. In syphilinum, it is written, na, alcoholic craving, hereditary in nature. Sometimes it is. In families, you'll find strong addiction to alcohol. Even children's, addiction to alcohol, insatiable craving for alcohol is feature of syphilinum. No, it is there. But even liquor, insatiable craving, Medorrhinum. So now you understand, right? Medo in many terms looks like, gives you a hint towards syphilitic miasm, but it is not. It is just one feature. Okay, so don't get misled by this. Now we just talk about modalities, and I'm just taking it directly from the books. Look at the underline. When thinking of it, Hallonius and oxalic acid. Last, we go to the last. From daylight to sunset, other things you can do. Amelioration at seashore, lying abdomen. Modalities you can read. Okay. Now the question is, okay, I've already answered this question, but when you read this, sometime it comes. Do all these features indicate psychosis? Question is that. No, it is not so. Rather, why, some syphilitic symptoms and traits we can find. So you cannot say that Medorrhinum is purely a psychotic remedy. There are maybe 80% psychotic symptoms, but 20%, 10-20% are syphilitic symptoms also. Craving cold internally and externally, night aggravation of rheumatic and mental suffering, insatiety for craving. This all looks like syphilitic. But this is not syphilitic. What is written in literature it is, yet it is rather sora, psychosora. Yeah, it is not syphilitic in nature. These all things that you read about, night aggravation, suffering in the night, craving for alcohol, cold they want. This is psychosora. So in literature, it is written about psychosora. Now, why should we know about this? I'll tell you in the next sentence. And this is very important for your clinical practice. What I'm going to tell you now. Combination of secondary sora and secondary psychosis. So it is a combination. Medorrhinum, when you read properly, you see soric features and psychotic features, the secondary ones. One must always not conclude the treatment without antisorics. According to symptoms, similarity to prevent recurrence. Now you'll say, okay, Medorrhinum itself is a nosode. Yes, it is. But many times you give Medo, but after that, look for the other symptoms to come. You might need some antisoric remedy which is coming next. Or nothing is coming, then at least you should give sulfur. You should give antisoric. You have to end the case with sora. Because the most dangerous thing is sora. The most prevalent thing is sora. More captivating thing is sora. Sora is everywhere. So Medo, puja you can say in and out psychotic. But when you talk about Medorrhinum, it is sora psychosis, psychosora. Hence you will see some, with symptoms which look like syphilitic, but they are not syphilitic. They are soric symptoms. Okay. So after giving Medorrhinum, patient is better. Wait for the new symptoms to develop. New symptoms develop, you properly repertorize, understand whichever antisoric coming you give, or else at least give sulfur to end the case. Otherwise, what will happen is that recurrence will happen. And you will think, oh, I have given anti-miasmatic Medo. No, it is psychosora. You have addressed psychosis, but you have not addressed sora. So you have to give soric remedy to end the case. Now, this is a last slide. Okay, last slide. So we have learned about a lot of features about Medo. I hope this lecture will be helping you out. It will definitely help you. So hereditary symptoms, the features, general features, the mental features. But there is one subject, that is one symptom which you should understand, is objective symptoms. What is objective symptoms? You look and you understand. It is not the symptom narrated by patient. So by just looking, is it possible that just by looking at the patient objectively, we can come to the conclusion that this is Medo? Yes, it is possible. And we should learn about this. A lot of time we are being said, we should look for the patient, look for the objective symptom, look for the objective symptoms. A lot of physicians talk about this, especially in children cases or elderly. I have one question. Okay, I have to look, but what should I look? How do I know what is the objective symptom that we have to look? So if you want to master objective symptoms, the book is Boger Synoptic Key. In fact, I've made this book. I don't know if you can see. I've written here objective. I take this book, and in this book, I only underline the objective symptoms. I underline with red marker and then yellow. Lot of places I have been doing this. Why I'm doing this? Why I'm doing this? Because I want to train my mind. I want to train my mind with understanding of objective symptoms. You can see this. I've done it many places. Yes, patient symptom has to come. Yes, his mentions we have to go deeper. Okay, but objective symptoms cannot go wrong, right? So what is the harm in understanding that? It can be an addition to it. So let us go and understand objective symptoms. This is very interesting. Where generally you will find Boger Synoptic Key. Should just open Boger Synoptic Key and read every word, and whichever looks like objective, you should underline. That's it. The first sentence itself is written here. Stiff, achy, sore, rheumatic. So, as we know, rheumatic complaint, rheumatic heart disease, rheumatic complaint, arthritis, important component of Medo. So they are stiff, always pain and aches, always aching and paining, and rheumatic. This you can observe. Patient doesn't have to say. You can observe this. Patient is having arthritis, rheumatic trouble, and very stiff and a lot of pains. Dwarfish. Okay. We already talked about it. I'm not going to go deeper into it. Dwarfishness. You have to differentiate with other remedy like Baryta carbonica. Acrid discharges. Acrid discharges. We learned about discharges. They are offensive. Of course, that is also objective symptom in a way. But acridity is very crucial. So discharges, how are they? They are acrid, means there will be burning and all. Fishy, offensiveness. So very offensive. So objective symptom can be narrated by relatives and the nearby also. There is one word very important said is written in Boger Synoptic. It is called meanness. Now, when we say meanness, what is the meaning of meanness? Meanness means people who are mean. We say that he's a very mean person. What is mean? Person who always thinks about himself, self-centered, selfish, okay, self-obsessed, only thinking of their own benefit. This is psychotic feature. And we already learned, if you see, go back, we already talk about now in this today's scenario, what's happening. We are becoming very mean and selfish and self-oriented. So meanness, only looking for our happiness. Cruelty. How to understand this? Happiness seeing in others, we already share. Happiness seeing in others suffer or getting hurt. Hurried. You'll observe this, very hurried, very hurried. Okay. Many ideas, but uncertain of excitation or non-committal. Now, this is written in one sentence. What does that mean? These are people who are non-committal. They will have a lot of ideas, no execution. So when you sit with patient for a long time, or he's coming, and then when patient come for a long time, 3-4 follow-ups, you know a lot about the patient. Then you will observe one thing about his personality, that great ideas he has, great ideas, but excitation is zero excitation. Excitation means execution, basically, uncertain, non-committal. They cannot commit on anything, non-committal. There's one word written, dismal outlook. Another remedy which is written in bracket is sinusicopa. What is dismal? Dismal means basically sad and depressed. How's their face sad and depressed? Dismal outlook refers to pessimistic, not optimistic, pessimistic, or bleak view of future or event circumstances, often characterized by sense of hopeless and despair. When you're hopeless, when you're sad, despair about future, that kind of look. I've tried to get some pictures from Google. Maybe this can help you. No hope on the face. Like there's a rubric, hopeful. Sulfur is there. If you read Boger's synoptic key or Boger's repertory, hopeful. Sulfur is there. But here it is pessimistic in nature because many ideas, non-committal, they cannot execute. So ideas are great, but they don't have courage to go out and do things. Ultimately, what happens? Dismal outlook comes. Hopeless despair comes. Other few objective symptoms, psychotic red moles. You can see like this. You must have seen a lot of patients with this. This is meadow. Moles on the face, moles on the skin also indicate psychosis. Thuja, when you read Thuja's skin, it is written moles on the skin. But here it is red moles basically. Red nodules, red moles. This is psychotic feature. So you can catch patient from this also. Tousled, I don't know how to pronounce this. Tousled heads. What is tousled heads? Tousled heads. Tousled head. I don't know how to pronounce this. Refers to hair that is untidy, messy, disheaved, often appearing as if it has been not brushed or combed. This is the look. Now, some people might be coming in your mind, right? So now imagine a patient, sad, dismal look, hair is always messy, not combed, not kept properly. Of course, now it's a fashion also. A lot of people look messy hair and want to look cool. That is a different thing. But I'm talking about patient. Okay? When patient is diseased, person is diseased, and you find these kinds of things, this is also one of the features of Medorrhinum. There's one word called blistering leukorrhea. There's one word written there in Boger, blistering leukorrhea. Another remedy is ammon and creosote. I started wondering, what is blistering? Leukorrhea is leukorrhea. Leukorrhea can be profuse, leukorrhea can be, acrid, bland, offensive. What is blistering? So what does a blistering means? Blistering, the meaning is very strong or extreme. So as it is psychotic, leukorrhea is important feature. So a lot of white discharge in female, which is strong. So Boric writes, leukorrhea thick, acrid and excoriating, fishy odor. So very heavy, thick, excoriating, as we know, discharges are acrid, and lot of offensiveness. Fatak writes, blistering leukorrhea, thin. He writes, it is thin, but fishy odor. So it is strong, very strong. Lot of leukorrhea will happen. It could be thick, it could be thin, but excoriating and lot of offensiveness. Patient will patient will complain you that please do something. My leukorrhea smells very bad. One of the features of Medorrhinum. And of course, psychotic sterility. There's a word written, psychotic sterility. So lady comes or male patient comes with sterility problem. Go back and understand psychotic base. This is Medo. So Medo can definitely help. So thank you very much. I'm done with this. This was a short discussion about Medorrhinum. I hope this makes a lot of sense. I've tried my best to share with you all the features that I find very important to know in patients, especially in a clinical practice. Also, the study does not end here. I know that you will go. Please open Kent Mater Medica. Please open other books. Try and get more knowledge about it, because more we know, more our mind knows, our eyes will see. Objectively, if you want to cite these remedies or any remedy in Mater Medica, we have to get into habit of learning more and more. But I hope these features will help you make proper notes of it, and definitely write in the comment how do you like this lecture, because that motivates me also. And I know this lectures are helping a lot of people, and I will wish to continue this and come back again with another nosode in this series. Okay, so thank you very much. Namaskar. Bye bye.